60 and FM 101.1.
This is the voice of Indiana County. 101.1 FM and AM 1160 WCCS.
It is the voice of Indiana County at 12 minutes after 8 o'clock, and we're in the studio this morning with Dr. Michael Suffradeni, who joins us on behalf of IRMC and a pretty exciting venture, I think, especially for folks down Blairsville Way in that southern part of Indiana County. Our visit this morning presented by Marcus and Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. Good morning to you.
Good morning. How are you doing today?
Wonderful. Good to have you with us here this morning as well. Maybe Dr. Brian Stone can come in and join us, maybe not, but we got you this morning, so we'll talk a little bit with you about what's going on at IRMC, because IRMC Sports Medicine, it remains at the HMI building on the campus, the main campus of IRMC, but now a location at IRMC at Chestnut Ridge.
Yeah, we're trying to branch out a little bit, just make it easier for patients from different areas. Work a little bit with some of the high schools in that area. Yeah. Just give the patients another location that they can come to.
How long have you been down there?
About 2 to 3 weeks so far.
Working well? People finding you?
Yeah. I think a lot of patients are used to the office there because the internal medicine has a family practice there and the urgent care is there, so it's kind of convenient. Yeah. They always can send people over to us right from their office. Yeah.
Now, you've been here at IRMC for how long?
About 3 years.
About 3. I know you've been here before in the studio, so we've met you before. But for folks to get to know what you do at IRMC Sports Medicine, that name sports probably can be a bit misleading for folks because it's sports type injuries, and that can run the gamut.
Yeah, absolutely. It's kind of a little bit of a misnomer. So basically, we do sports injuries, sprains, strains, pulled muscles, get you through in that. But we also do a lot of tendonitis, arthritis, aches and pains, just really something for everybody, really, whether you're into physical activity or even your job, if you labor. We can kind of help with any of those types of injuries.
Yeah, I wanted to ask you this because I've wanted to ask this of Dr. Bone before and of Dr. Stone. Sports medicine, in order to be a practitioner of sports medicine, it's a good idea to have an idea of what those injuries feel like. So are you athletic? Do you participate in sports? Have you suffered a bunch of the injuries that we get?
Yeah, so I probably am more of the weekend warrior at this point. But at this point, I just really work out. So I do CrossFit. So I've been lucky that I haven't injured myself too much doing that because I try to be safe and be smart. Mm-hmm. But I've broken my wrist playing softball. I've pulled hamstrings. I've gotten tennis elbow and tendonitis in my elbows. So I've kind of been through some of the same injuries.
I've had all those too.
Yeah, it's kind of a fact of life.
Yeah. And in fact, an interesting thing, last week, I put on the hockey skates for the first time in a really long time. I've had 2 knee surgeries since the last time I had hockey skates on. Boy, did my knee feel it.
Oh, yeah.
Because that's a whole different motion, that push-out motion on hockey skates. Those sorts of things, people reactivate something that they haven't done for a long time. That can lead to injury if they're not doing it right.
Correct. Yeah, and I think it's also a confidence thing because you kind of remember what you could do, so you want to do that again. And instead of kind of easing in, taking it slow, and taking the slow path to keep you out there, people sometimes overdo it too quick. And that's a lot of times how they hurt themselves, is just doing a little too much too quickly.
Yeah. That's a good point, too. And it not even for somebody taking up something they once did, but people trying something for the first time, and they watch it on TV, they say, I can do that. Ski slopes, we think of that a lot, don't we?
Oh, absolutely. Yeah, I think the biggest one at this time of year is even just working out. People want to be in the gym, they want to be consistent, they want to go, 5, 6, 7 times a week. When you're just starting, it's a lot of stress on your body, and you really need to get your tendons and joints ready for that type of impact. Mm-hmm. And really taking it slow and slowly progressing is probably the safest way to do it to avoid injury and keep that progress going.
Yeah, and we think of walking and running. Running will be an increasing activity for folks as the weather gets warmer. They get back outside. Maybe they're doing the treadmill right now. But running can be very damaging too. Again, if you're not doing it properly, the footfall, the stride length, all of the different things, and we tend to want to go like we're 18 years old, even though we're 60, 70 years old.
Yeah, running's pretty brutal because it's just a constant impact. You're going long distances, doing it for a long time. It's very repetitive. I try not to mess with people's gait too much because depending on which research you look into, some of that actually causes other injuries because now you're almost restarting, but you're not really restarting your running journey. So you're able to run, 15, however many miles you run, and now you're trying to start it from a completely new base, and that sometimes leads to injuries as well. But I think with that too, it's just starting slow, slowly building up, trying to keep those miles kind of consistent with some breaks in between.
People would be really surprised at the amount of force that running does with every step, wouldn't they?
Yeah, I think there's a crazy statistics on marathons, that training for marathons. I think it's somewhere between 40 and 60% of people are going to get injured just during their training of like a marathon. So it's a brutal sport.
Yeah. Years ago, I was writing commercials for IRMC Sports Medicine, and we wanted to make the point that it's not just athletes who suffer athletic type injuries. It's people climbing ladders and getting into awkward situations. It's missing that step coming off the curb as you're walking down the street. There can be all kinds of reasons, slips and falls, especially at this time of the year, that you have a sports type injury, and they all need attention.
Yeah, absolutely. You don't really have to be playing a sport to get injured. Like you said, slipping outside, picking up a piece of paper, people hurt their back. Any type of ache, pain that you're having, we always can take a look at and see what we can do for you, try to get you back to getting out there.
Shoveling snow.
Yeah, hopefully no more this year.
Yeah, that's my vote as well. We're talking this morning about IRMC Sports Medicine, the new location at IRMC at Chestnut Ridge. So you're in there now, and you mentioned working with school athletes and weekend type athletes as well. Those injuries that happen in a scholastic setting, that you're dealing with young bodies. Then there's a difference between a young, supple body that has much more agility, much more flexibility, than working with somebody who's a little bit older and a little bit stiffer.
Yeah, I think working with the younger athletes, luckily they get better typically a lot faster than we do, just because they're still growing. They have a lot of kind of potential in that. So a lot of times really it's trying to work with them to slow down a little bit, maybe fix some of their mechanics, and then they're able to get back. Mm-hmm. Older patients, typically it's trying to just practice good form and put yourself in a good situation that you're not kind of lending yourself to getting injured.
Yeah. When someone bangs up a knee, twists a knee or does something like that, automatically the tendency is to think, oh no, surgery. That's not the case with sports medicine. It doesn't have to be.
No, most of the injuries honestly don't require surgery. If you have a big ligament tear, you tear your ACL, PCL, those historically do have surgery, but even though sometimes you kind of actually can rehab, and there's some studies out there that you can get back to sports. You wouldn't want to be a professional athlete without an ACL, but you can definitely kind of, for the most part, do your regular activities without one. And if we're able to rehab you correctly, then that is something that's possible. And then in terms of just, slipping, a lot of times you actually don't end up tearing ligaments and things like that. It's just kind of the joint's achy. You might have some arthritis that you've flared up. Mm-hmm. And a lot of times we can just take care of that for you in the office.
Yeah, there are all kinds of different treatment options, aren't there?
Yeah. As simple as, taking Motrin to other prescribed medications, physical therapy, home exercises. We do a lot of injections. You have a few different injection options as well of what's kind of going into that area. So I try to work with the patient, see what their kind of threshold of what they want to do or how conservative they want to be.
Talking this morning with Dr. Michael Suffradeni and IRMC Sports Medicine, now with the location at IRMC at Chestnut Ridge. People want to get in touch with that office and use that office. What should they do? Yeah,
so if they want to, they can give us a call. Our phone number is 724-357-7075.
Just schedule an appointment right there through the scheduling center.
Yeah, and just tell them what times are available for you.
Terrific stuff. 7 or 5 days a week, 7 days a week. What's the schedule there?
We are there currently 4 days a week, Monday through Thursday, 8 to 4:30.
Yeah. And of course, you have a relationship with the various physical therapy outfits and with occupational therapy, even with surgery. If that becomes an option, you can can help to facilitate that, whatever is the patient's need.
Yeah, absolutely. Yeah, so a lot of the physical therapy kind of send you, me personally, kind of where it's convenient, because obviously it's an extra thing you got to do in your day. It's usually during the work week, so it's got to be close to work or close to home. And then in terms of surgery, depending on what your injury is, we have surgeons that we use and that we like, and we try to send you to them and work with you and work with your insurance as well, because that can be a big thing.
Yeah. So 3 years here at IRMC, and coming from where?
Philadelphia.
From Philadelphia. So after 3 years, what do you think?
I like it so far.
Yeah.
It's been good. It's been great for my family. We're based out of Pittsburgh. My wife just started working her big girl job, so she's now a gastroenterologist in Pittsburgh. So it's worked out great for us so far.
Yeah. Enjoying your time here.
Absolutely.
Terrific. Well, good to have you back in the studio with us this morning. We appreciate you coming in to visit with us. And again, there you go, boys and girls. IRMC Sports Medicine now operating both at the Human Motion Institute at IRMC on the main campus and at IRMC at Chestnut Ridge there in Suite 109 there. The number to call, 724-357-7075 if you'd like to make an appointment there. Thanks for coming in.
Thanks for having me.
It's the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Good morning, and thanks for being with us here today. AccuWeather tells us breezy, up to an inch of snow this morning. We're on the way to 35 degrees. I don't know about that snow forecast. We'll do without that if we possibly can. Boomer Sports coming up here in just a moment or so here on Indiana in the Morning. And then in our next half hour, we talk to an employment expert who's going to tell us, the young people are out there, they're working hard, they're getting the education that they need to pick up a wonderful job, but people aren't hiring them. What's going on with that? It's Indiana in the Morning. It's WCCS.
Hello again. It's me, Garrett Greek, your local mortgage banker at S&T Bank.